Hi, this is Mark again without Brian. So I'm going solo. Okay. So this is going to be the first video of what I did for myself, rehabbing my own knee. So, a couple things I want to tell you with and lead off with. Number one, always listen to your physician, what they tell you. Second thing is if you're having PT from someplace other than here, always listen to them. I'm telling you my experience, but also since this is me, I could experiment on myself. If I did something silly on it, then nobody's hurt but me, and that's okay. So what I'm not telling you is this may work for you. I think it would, but you still listen to whoever is guiding you along that and listen to your body because that's all I did. And that's how I learned what to do or not to do was just listening to my body, what the pain was telling me, what felt right, what didn't feel right. So the first thing I want to go over is how did I get the range of motion back so quick? So here's the techniques that I use. Okay. I would sit in the chair. Okay. And I told you I didn't use a massage gun because that was way too painful. I just used my hands. I would take them. I would pretend. So the best visual I can give you is like taking a wet sponge and squeezing a wet sponge and releasing it. So what doing, and keep in mind too, when I first started is everything was a whole lot more swollen too than what it is now. And this is exactly what I did with all that swelling over the whole length of that lower extremity. I would compress in, I'd compress out. Again, not trying to kill it, just easy, but I'd go all up and down it. Okay. All the way through. Now I'd spend more time at each level than what I'm showing here, but all over. I would rotate it just like this. So just getting that soft tissue to rotate. Because again, think about you are rinsing out a wash ring. So I would work these techniques just like this. I would stretch this way. So just by pulling, because you can see that just with these pants on, if I pull up here, it affects all the way down here. Well, that's the connective tissue underneath your skin as well as your skin. It's all connected. So just by moving here, I was mobilizing that incision so it didn't get healed or it didn't get scarred down. Because if that gets too scarred down, then you lose your range of motion because it's pulling through that incision is painful. I would do as after the incision was healed, I would take directly over it and I would just pull and stretch and just, again, just a slow, easy stretch. Just like if you put your hands on the side of a boat in a harbor and just slowly push, you can move that big, heavy boat. Okay. Well, that's what I did, all directions, just let that mobilize. That unstuck the incision, if you will. It gave me the range of motion. Then the stretches I did, and I would always check it then, laying flat on a table, putting both knees out and see how much space was between the table and my fingertips. So my whole knee was flat. You can see my other one doesn't even go as far as this one. Okay. Because because of the arthritis and that. So with that toned knee, I got the neck range of motion back. So what I did for stretching, I would just put my leg out here straight, comfortable. I would take and just my hand above the kneecap, so on the thigh, and I would just gently put a little pressure down as I reached forward, just like this. So just a little downward pressure, a little bit of reach, and feel that loading all the way up and down through here. Never did I force anything or force pain. I always kept it as comfortable as I could because then the brain wasn't threatened, and because if you go into pain too much, your brain says, okay, you're going to hurt yourself. I'm going to tighten it up. So never did I force it. Never did I feel like, well, I have to have this range tomorrow. So I just went nice and easy here. Then I would rotate the foot out as I would go because your hamstrings and those tissues come down on angles. So by rotating it out, doing my reaches, rotating it in, and then you're getting the way that those fibers run. And that's what allowed me to get my straightening. Okay. So the bending, I did the same thing. I sat here. Now, when I started, I was here, but again, and I did all of this a lot of times a day, every day. That's another thing that, so I rehabbed myself and did the things every day, which is what you got to do, or I feel you need to do. So I'd work that, and then I'd go back to where I felt a mild pull. I'd rinse the rag out. I'd squeeze and push the water out of the sponge. Then I would just a little bit lean forward, gave me a little bit of stretch on that. If that loosened up, I'd take it back a little bit further. Now, an inch back here made a big difference here. So you don't go back too far. But what I never did was crank on this or think, okay, you got to get that bent. Everything is comfortable, not increasing my pain level, a mild discomfort, but not what I would call pain or not something that I wouldn't want to do. So by just doing that, allowing the body to adapt to these new levels, helping get rid of that fluid by just doing this all day long. Anytime I sat, I'd find myself 3 or 4 minutes at a time just doing that. And it really did wonders for it. So those two things are how I got my motion back. Not always the typical way that people do it, but again, because I've had patients come in and they said trying to get their motion back was so painful because they were cranking on it and felt like you got to force it. Nothing did I do forced it. So that's my range of motion. I've got, it's 100% back with the bend and the straightening. And yet because I still got a little slack, I still do this. Plus it just feels good. So if you have further questions, contact us at fitness4lifept.com.